everybody. Welcome back to Pelvis Party. My name is Becky Monpetit. I am the owner of Rochester Local, and today I am joined by Amy Nelson. She is a nurse practitioner at the Virtual Care Clinic, and Britt Marshall with Marketing and Communications at Olmsted Medical Center. Good morning.
Good morning.
Good morning.
Thanks so much for being here.
Thank you for having us.
Today, what are we talking about?
We are talking about the Virtual Care Clinic at Olmsted Medical Center.
I love this.
So exciting. It's new.
It's new. We started in January, so we've got our wheels oiled now and open to see patients of all kinds.
Okay, so what is the Virtual Care Clinic?
So it's pretty much a telehealth clinic. So they're on-demand video visits. We also have some pre-scheduled appointments as well if patients want to be scheduled.
Okay.
And it's open Monday through Friday from 5 p.m. to 9 p.m.
Okay. So right off the bat, Virtual Care Clinic. How do I make an appointment at the Virtual Care Clinic?
Wonderful. There are two ways.
Okay.
You can call Olmsted Medical Center, and one of our wonderful receptionists can help get you on the schedule. There are appointments available at 5:30, 6:30, 7:30, and 8:30 p.m.
Okay.
The other way, and probably the most common way to get an appointment, is just to actually log onto your MyChart account, and you will go to menu, find care, and you'll see on-demand video visits.
Okay.
I wish it said virtual care because it does get a little confusing, but basically under Find Care, on-demand video visits.
Okay.
And you will choose that. You'll have to confirm you're in Minnesota because as a patient, you have to be in Minnesota for me to take care of you.
Okay.
And then you'll choose your condition that you'd like to be seen for. And there's a whole list. You'll choose one that fits most appropriately for that visit.
Yep.
And you'll go through some information, some demographic information, confirming insurance. And then you'll be on my schedule, and I will join you within 5 to 20 minutes.
And that sounds like a lot, but it's not.
It
It's
sounds like a lot.
super easy and convenient.
Yeah. Well, logging onto MyChart takes 0 seconds.
Right.
Unless you
And-
forget your password. I've done that a lot of
Right.
times.
But we do have a great team that can help you
Yes.
if you do
Yes.
need
And
assistance.
this is just an aside. In the MyChart settings, I saw where you can add a passcode. You can actually add a passcode into MyChart for my settings. So instead of using a password, you can add a passcode. And I did that.
Wonderful.
And you can do it on your app too.
I will have to try that.
Yes, it's amazing.
Yes,
Anyways, so you can just go into menu, find care, on-demand video visits.
Yes.
That's easy.
Yes, and it does work best from a phone.
Yeah.
It can be done from a desktop or a laptop, but it works really nice from a phone.
And 5 to 20 minutes.
It's usually less time than that, but it just depends on if I'm with a patient. But yeah, within 5 to 20 minutes. And I believe you'll see your appointment time. Actually, my Epic team says you can't, but my patients are telling me that, like I saw, I have my appointment 6:15. So you should see the
Wow.
time that you'll be seen.
Amazing. And so these are appointments that are offered after hours.
Yeah, after hours. Yep.
I
And
think how that changes the game.
It
for,
does.
Like, families or working. You don't want to take time out of work
No.
to go to an appointment. You can just hop in the queue and be
Right.
seen.
Right. And I mean, urgent care. You think about how often are things like, sore throats or strep or whatever, these sorts of things, you find out about them after school. Well, by the time it rolls around, well, you need to see someone now. It's closed. You need to have something in the evening hours. So this is really convenient for families.
yes.
Super convenient for families.
Patients seem very happy once they figured it out.
Yeah.
And logged on. I've seen patients over and over. I've had some patients come back and see me. And I'm glad you brought up strep throat because we can order tests.
Yeah.
Patients would present. I would let them know, where to have that done. But I can order testing. I can order radiology. I can refill prescriptions. And there is so much we can do through the camera, more than I ever dreamt possible.
That's amazing. So can you tell us some of the other things that you're able to treat?
Yes. We have a whole list, and you can find it on Olmsted Medical Center's website. And also when you log on for an appointment, you'll see the list. I could list a lot of conditions, but I'll name a few. Acne, allergies, asthma, mental health like anxiety or depression, medication refills, back pain, cold symptoms, sore throat, ear pain,
UTIs. we just talked
UTI is
about
a big
that
one.
on another
Vaginitis.
episode.
Yeah.
Now, as far as like vaginitis, I wouldn't necessarily be doing an exam
Yeah.
through the video, but I can gather a lot of information.
Yeah.
And I still like to do physical exam, and the patient can assist me with that process. We really become a team
Uh-huh.
through virtual care,
Yeah.
which is something I didn't anticipate as much. But
Yeah.
it's been really fun. So the patients can help me with some of their physical exam.
Mhm.
But a lot of times it's the history that tells me the
Mhm.
most.
Yeah.
And certainly if I can't, if I'm not sure how to take care of the patient, I will get them to the right place
Sure.
and I'll make sure there's follow up. But it's
Mhm.
been very rare where I've had to turn a patient away.
Okay, so I would imagine that you see a multitude of different requests or symptoms or whatnot. What would happen if a patient comes to you and would need a referral or just something that you can't see or would need to be a primary care or women's health or something like that? What would happen then?
Oh, what would happen would be, definitely based on their symptoms and their needs.
Hmm.
We would make a decision together. I'd help them find a department, make that referral, and maybe even help guide them to a particular provider that I feel they might fit well with.
Hmm. And you have actually been in women's health for 24 years.
Yes, this is the month of my anniversary for 24
Oh,
years.
congratulations.
Yeah, thank you. I'm
Yes.
proud of it. I'm very, very proud of the OBGYN department at Olmsted Medical Center and being a part of that.
Right. So you're able to talk about things like STD screening and birth control and abnormal bleeding and UTIs and informed decision making and symptoms and all these sorts of things as a provider, and also work very closely and in tandem with the providers in that department as
Yes.
well.
Yes, absolutely.
Right.
Hmm.
And so you're going to be able to either treat, diagnose, or make referrals over
Yes.
to women's health.
Yes.
So
Yes.
that teamwork, that teamed approach at Olmsted Medical Center, I just see virtual care as another amazing, amazing step for patients to be seen. Just another accessibility point, right?
Yeah, I
Yes.
was gonna say that too. Like, just think of the access that people have. It's You're not waiting months to get in and scheduled for something. If someone came to the virtual care clinic with pelvic pain and they did need more of an exam, Amy could see that patient outside of the virtual care clinic because she does practice
Yeah.
in the OBGYN clinic
Yeah.
still, or refer to another provider.
Mm-hmm.
Yeah, and I have seen patients, and then they've followed up with me in clinic, or I've gotten them,
Mhm.
referred and follow up with another provider, maybe one of my MD colleagues or DO
Yeah.
colleagues, if they need more of an expert level of care or
Yeah.
something higher level
Yeah.
than my scope of practice.
Yeah.
But yeah, and that's the beauty of being part of the OBGYN team, but also just having been at Olmsted Medical Center for so many years.
Mm.
I have ties to many departments, from family medicine to internal medicine to orthopedics.
Mm-hmm.
And it's so great. It's a smaller organization, so I can message or call or text, many of my
Mhm.
colleagues. So I just feel like it is a great access, and I'm gonna get them taken care of, regardless of what they need. We can meet
Right.
their needs for sure.
Right. I was thinking about this virtual care and this new sector of medicine, telehealth, and these sorts of things, and really the importance uh, of accessing medicine or accessing treatment or care for people who just really suffer from anxiety
Hmm.
uh, when it comes to medical care or medical treatment, or just leaving the house, or the difficulty of going across town and parking and going. There's just, for those that suffer with situational anxiety or leaving the house or whatever, doing all of those steps can just be so draining. And to face someone with a medical issue on top of all that is enough to just simply not be treated altogether.
Hmm.
But if they can stay within their home and then see a friendly face and be treated, and then maybe develop a rapport with someone,
Hmm.
and then maybe be comfortable enough to make the steps to come in and be treated
Hmm.
in person by you, that's some powerful stuff,
Hmm.
Mhm.
That's beautiful. Beautifully said.
right? That's some really powerful stuff. And that's what we're trying to get at when we talk about pelvis
Mhm.
party, is um, that we don't have to settle, and that Olmsted Medical Center is constantly trying to improve ways to reach their
Reach
patients
Yeah.
and
Yep.
making care accessible to
Mhm.
them,
Mhm.
making the entry point to good health starts with great care,
Mhm.
right? And
Mhm.
just making that entry point
Yeah.
available for everyone,
Yep.
not just those who can get in their cars and drive across town,
Mhm.
right?
Right.
So virtual care, I just see it with, I just got goosebumps.
Yeah.
Virtual care just seems like just such an important step.
Mhm. Mhm.
Ooh, you're doing good work.
Wow, amazing. It is amazing. It's amazing, just to have this accessibility, to have this option for patients. And once patients, have, it seems like a barrier. AJ and I were talking earlier about how it's different. It's a different way to do things. But it can be so empowering, and then we can make such a great connection and develop that rapport through the telehealth visit, which it's been more powerful to me than I thought. I was, a little worried about being able to make that connection with patients, because I think I'm good at that, and I care. We care about patients, and I think it's very compassionate care, and it's a great kind of introduction to OMC and getting them established, and maybe getting them into the clinic eventually.
Well, that's the hope.
Yeah.
Well,
Yeah.
amazing. Well, thanks for coming in and telling us all about virtual care. So again, if people want to access it, they can call OMC and get scheduled, or access it through My Chart. And they can just go onto their My Chart, find care,
Yes.
on-demand video visits, and from there they can schedule.
Yes.
Perfect.
Yes.
Thank you, Amy.
Yes.
And thank you, Britt. And if you're interested in learning more about what we talk about on Pelvis Party, go to rochesterlocal.com/pelvis party.